Now the Alliance is the 4 partners. What we will be working on this year is to actually moving into the second stage of development, which is tagging in our affiliates. And so the affiliates are in several different areas, one of those being clinical, then the agencies, as well as the academic institutions. And so what we're talking about, again, one of the important pieces of the Alliance itself is to be able to have an impact on the health in the state of Delaware. And so we're rapidly in conversations with people from BB and Bay Health so that this spreads throughout Nanticoke, all of these, so that it spreads throughout the state of Delaware and you can have that impact. In addition, we are working with Rita Landgraf, our Secretary for Health and Social Services, on writing a memorandum of understanding between the Alliance and the state so that we can also roll out some of the ideas into our state programs in educational areas as well as in research and intervention areas. And then working closely with the Division of Public Health as well as the Healthcare Commission. And then academic institutions, we have wonderful partners in the state. And again, there are lots of collaborations that are ongoing amongst our academic institutions, and we're looking forward to fostering those in very significant ways. So how do you facilitate collaborations? How do you make these really work? And so there's a number of different things that, that we are implementing to actually make these partnerships, these collaborations real and to make things move quickly. One of these is a memorandum of understanding. There was an MOU that sets out the relationship amongst institutions. This is extremely powerful because then as individuals collaborate, they can always go to the institutional level to say, all of the details of this are already worked out. And I'm sure all of you in companies can appreciate how all of these things need to be laid out in these memos. There is a memo that we're now working on, it's almost completed, that will govern our research aspects. And this becomes important as you talk about intellectual property and exchange of licensing and all of this. And also the idea of facilities, how we jointly do facilities together. And Calvin Lee and I have been talking a lot about development of core facilities in these areas. How does the Alliance get organized? It is governed at the very top by the 4 presidents and myself as the executive director. This gives it enormous power. This allows you to move quickly. You get the 4 presidents together. We do conference calls all the time. We put on our radar screen, these are the things we want to move forward. It moves down then through each of the institutions. We formed a coordinating council, and then the working groups or the task forces are the places where things get done. So Carl Steiner has just been absolutely instrumental in moving forward our Research and Development Committee. Now this is actually another area that I would like you to all think about. Is we have communication and marketing, information technology, curriculum and education, community engagement, as well as research and development. One of the things that we are just forming these task forces now, if any of you are interested in being on these task forces, this will be a wonderful way to integrate our organizations together and I think give us nice opportunities to, on the ground, find ways to work together and enable this. The university now has a Delaware Rehabilitation Institute. It will have a home on the Chrysler site when that gets built out. And that is groups of scientists working together with clinicians and working in the area of rehab scientists. I mentioned core labs. We're working a lot with Calvin Lee on this. And again, I think this is something you will continue to see move out. Some of the best technology, as you're probably aware of, is extremely expensive, and so bringing groups together that they can do this is important for efficiency and cost reasons. Interdisciplinary centers I'll talk about, and then Carl mentioned to you already the CTSA grant that everybody has been working on. I'm going to move through these quickly so that I can show you the Chrysler pieces, but again, I want you to see sort of opportunities for collaboration. Shared faculty and students. I mentioned earlier the possibility of doing joint hires, but also joint appointments for non-dollars is another way that individuals can work in the universities and through the Alliance and have a real impact. And then joint education programs. We're doing a number of these that I mentioned at the very beginning. with Jefferson. Most notably, there are a couple that are going to happen in the next couple years. One of these is the development of a physician assistance program that we'll be doing with Jefferson. And they're very anxious to anchor that in Delaware, which I think will be fantastic because this will give us more primary care and we'll be able to enter this throughout the state. And we'll do this in combination with our very strong nurse practitioner program that we have here as well. So this together will combine to create opportunities. Another thing that we have been doing in our college, and we will continue to do and expand as we move to Chrysler, is interprofessional education. And what I mean by that is actually training healthcare professions as a team before they meet at the real patient bedside. And so this year, and Kathy Schell, who is our interim director for nursing, is here, and you can ask her about this. They have some fabulous programs that they're doing. Theater students are our standardized patients. We have physical therapy and nursing students all working together to learn how to interact with the patient and deliver health care. These programs are fantastic. Imagine adding medical students, physician assistants, nutritionists, physical therapists, exercise scientists to this team. Wow, comprehensive care, the best you can imagine. Then we are also partnering with Jefferson in the area of public health. We've created a public health minor. They have a new master's degree in public health and a school for population and public health. We're also looking at the possibility of expanding and doing some things in the area of global health. And I think there will be some opportunities there. And then, of course, the idea of joint research funding. We have small pilot seed grants that we give each year, and there have been 4 of those awarded, and we have another round of funding coming up right now. Those are all judged as like an NIH panel. And I'll talk about some other opportunities for awards. And then this is the CTSA grant, or Clinical Translational Science Award, that Carl mentioned. DVIX is a translational institute that Jefferson has developed, and it overlaps, and we leverage each other in order to accomplish some great things in translation. We also have, just so you know, a Women and Children's Health Conference that is coming up in December, and that will be on the website soon. There is both, if you go to the UD website, there is a website for my college as well as a website for DHSA, and you can get most of the information you need there about what's happening.